Welcome to #Wednesdays Weekly, a weekly information session in collaboration with the voluntary sector and public sector partners. Today's session is on refresh of Greater Manchester VCSE Accord, and our host is Emma. Over to you, Emma.
Thanks very much, Laura. So before we get going, I'll just introduce myself. So my name is Emma Meehan, and my role is Strategic Lead at 10GM. So for those of you who might not know so much about 10GM, we are a joint venture to support the local VCSE sector in Greater Manchester. So we're made up of a number of the local infrastructure organisations across Greater Manchester. Currently our members are Salford CVS, Bolton CVS, MAC covering the city of Manchester, and of course Action Together covering Oldham, Rochdale and Tameside. So we work together to share information, to have a collective voice, and to improve the effectiveness and impact of the sector, and thereby improve outcomes for local communities. But I'm coming today with a slightly different hat on. Quite a significant part of my role is supporting the work of the Greater Manchester VCSE Leadership Group. So this is a group that was set up to ensure that the VCSE sector had a strong voice in Greater Manchester's devolution process. So it was set up in 2017 to kind of make sure that there was a strategic voice and a strategic shaping of the relationship between the public sector and the VCSE sector as Greater Manchester took on more devolved powers. So I'm one of the supporting officers for the leadership group, and so part of my role is around supporting that work. Now I'm just going to start sharing screen because I have a few slides to go through before we get to the discussion. Now I just want that to go on to slideshow. There we go, perfect. So today's session specifically is just going to cover a little bit of background information, what actually is the Greater Manchester VCSE Accord, and why do we want to spend some time talking about it. Well, I'll then be just sharing with you the draft content of the refreshed Accord agreement that we're currently working towards, and then talk a little bit about how this Accord agreement will actually be delivered in practice, and then we'll have some opportunity for discussion. There are a few slides, but I want to kind of get through those and make sure that we've got plenty of time for us to have a conversation as well. If at any point during my presentation you just want me to stop and clarify anything, feel free to just speak up, because I've got the slides up, I might not see you, so just take yourself off mute and pitch in. Okay, so the background to this is, as I mentioned, the Greater Manchester VCSE Leadership Group was set up in 2017, and one of the first things that it did was draft and sign the original Greater Manchester VCSE Accord. So this was a 5-year agreement between the Mayor of Greater Manchester and the Greater Manchester Combined Authority and the VCSE sector. Simultaneously, there was also a different agreement, a Memorandum of Understanding, signed between the Greater Manchester Health and Social Care Partnership and the VCSE sector that was specifically focused on the improvement of health and well-being of communities in Greater Manchester. So actually, it makes much more sense for there to be a singular agreement between the public sector and the VCSE sector, rather than having two different agreements working to kind of different objectives and outcomes. So what's happening this time round is that actually there'll be a single document which is going to be jointly owned between the Greater Manchester VCSE sector, the Greater Manchester Health and Social Care Partnership, and the Greater Manchester Mayor and the Combined Authority. In January 2020, the GM VCSE Leadership Group published its VCSE policy paper, which has a real focus on, it has a 10-year vision on supporting and transforming the sector, and not only transforming the VCSE sector, but transforming the way that the public sector works with the VCSE sector. And that was developed through quite a lot of consultation with our sector. So some of you may have even been involved in some of those consultation and engagement sessions in 2019. So just to touch on that VCSE policy paper, what does it actually involve? It looks at 5 key areas to build sector capacity. So firstly, a programme to support the wider workforce, including VCSE staff, volunteers, so the whole VCSE family, and really looking at that workforce capacity and capability, and making sure that we've got a strong and resilient workforce. Secondly, the policy paper looked at implementing the VCSE commissioning framework. So this was a framework that was about what good commissioning and procurement with the VCSE sector looks like. So it touches on things like how to embed co-design and co-production in commissioning processes in a meaningful way, and how do you make sure that commissioning looks at includes queer questions about social value, and recognizes the social value that the VCSE sector brings. Thirdly, the policy paper advocates for promoting the sector role in early intervention, prevention and population health work. So really the bread and butter of the VCSE sector, the stuff that we're doing every day, and also recognising how critical that early intervention and prevention work is, and that actually there is a strong business case for investing in early intervention and prevention work, so that actually fewer people are at that crisis point when they are seeking support. Fourthly, there is a real move at the moment, and I've certainly seen a lot of this quite recently, a lot of discussion around what an inclusive economy that's run by and for local communities looks like. And I also think there's been a lot more discussion recently about recognising the VCSE sector as a really important part of local economies. So, you know, VCSE organisations locally are employers, are providing volunteering opportunities, which are upskilling and working with local communities. A lot of staff are very locally employed, so their salary money is actually going back into the local economy. So there's a real move to think about how the VCSE sector is considered a much more significant part of local economies. And then finally, how do we build an integrated approach to working with and via the sector across equalities, boroughs, local communities, all those different kind of parts of the VCSE ecosystem to address inequalities and the wider determinants of health. Okay, so moving back to that new Accord agreement, it's going to be informed by a number of things. So firstly, reflection, looking back on the last 4 years, what's worked well, what hasn't, you know, where have we seen positive changes as a result of having this accord in place. The second area is engagement, so a series of structured conversations across the VCSE sector, as well as officers, politicians and commissioners representing the Greater Manchester Combined Authority and the Health and Social Care Partnership. And this session, of course, is one of those structured conversations. And then also learning from our recent experiences. So actually, you know, the last Accord agreement between the public sector and the VCSE sector was, you know, years before our experience of COVID. We've got a greater understanding now of the picture of inequalities in Greater Manchester, particularly informed by the recent report of the Greater Manchester Independent Inequalities Commission and the recent Michael Marmot report, Building Back Fairer in Greater Manchester, that really exposes how inequalities amongst our communities have deepened in the last 18 months in particular. And there are also changes to our health and care governance in Greater Manchester with the development of a GM integrated healthcare system. So changing the way that healthcare is governed and delivered in Greater Manchester itself and Greater Manchester's 10 localities. So I'll just pause there for a moment. Are there any kind of questions or anything anyone wants to raise before I carry on with the slides? No? Okay, fantastic. I'll carry on. So what actually is this VCSE Accord agreement that we're talking about? So the purpose of it is to develop a collaboration agreement between the Mayor of Greater Manchester, the Greater Manchester Combined Authority, the Greater Manchester Integrated Care System, and the VCSE sector. And that's something that's co-owned and is based on a relationship of trust. And what the Accord is trying to do is to describe the VCSE sector role in the delivery of strategies and initiatives at a Greater Manchester footprint. So particularly the Greater Manchester strategy, which is being renewed at the moment. So sorry, my dog is just barking very loudly, so I got thrown off course by it for a moment. So the scope of the agreement, I think this is important to say because this is an agreement that exists at a GM footprint level, and certainly the conversations that I've had with other local infrastructure organisations and member organisations has been, okay, well, that's lovely that that exists at a Greater Manchester level. So how does this impact on a locality level? Now, the agreement itself is, as I mentioned, signed by those organisations at the GM level. But I still think that the Accords can be a useful tool for VCSE organisations at that locality level to look at how a relationship might be shaped, actually working with your local authority, you know, what might the principles behind that relationship, what might those principles look like? So I think it is quite a tricky question. You know, we know that there is a level of autonomy that localities are operating at, but they're also part of this Greater Manchester system. So I think for me, probably the biggest challenge of this accord is how do we make sure that it's actually relevant to VCSE organisations working at a neighbourhood level, maybe a locality level. So it'll be interesting to hear any thoughts that you have on that when we get to the discussion. I've already kind of talked about who's involved, so I won't kind of go back over that again. But in terms of the timescales, this Accord agreement is going to be for a period of 5 years, commencing this October. So a relatively long-term agreement. Okay, fab. Well, I will. We're actually on to the content now, so that's exciting. At the top of the Accord will sit our shared vision. So what do we want what do we want our objectives together to be? And actually some of the feedback that we've had so far from other engagement sessions is that this vision, whilst it talks about good lives for all and making Greater Manchester one of the best places in the world to grow up, get on and grow old, that's language that you might recognise that's been used as part of the current Greater Manchester strategy. Actually, we need to be a little bit clearer about what this means specifically for the VCSE sector. So what do we as a sector think is important? How do we think we tackle some of those big challenges of poverty, of austerity, of moving into recovery from COVID? So again, I'm interested to hear your thoughts on that vision and whether that feels right for you. It then moves into a number of principles. So these are really the principles for what that relationship should look like. I won't read these out because there's quite a lot of words here, but I'll just pause for a moment and give you an opportunity to have a quick read through. But effectively, these are the kind of draft of the principles from the VCSE sector side. So how do we see that relationship working? What is our role? What is our responsibility? So I'll just pause for a short moment to let you read those. Okay, I will come back to those when we get to the discussions. There'll be more opportunity to kind of go through those in detail. Then we have a set of principles, but these are from the side of the public sector partners. So this is their commitments around how they will support the Greater Manchester VCSE sector. So again, I think it's really important for us to have a look at these and say, you know, do we feel that this is covering the important points? Is this how we want the public sector to be working with our sector? Is anything missing? Is anything kind of misdescribed? So again, I'll just pause for a moment and give you an opportunity to have a quick read through those bullet points. Okay, thank you. And then finally, there are so we've got the vision, we've got the principles about how the public sector and the VCSE sector in Greater Manchester will work together. And then finally, what we want to do is co-design a set of shared objectives. So, you know, that's great, we've set out the principles, but what do we want to achieve over the 5 years? And again, there are three kind of draft objectives here that we'd really like to get your feedback on. So the first is around valuing and maximising the impact from the role of the VCSE sector. So I think particularly there's some really important learning from COVID, and actually how the VCSE sector's been a really vital strategic partner in working together with the public sector to respond to COVID and to meet the needs of communities during that time. The second proposed objective is around transforming the VCSE sector by delivering that VCSE policy paper that I touched on earlier around, you know, a resilient workforce, around supporting the sector to play that really important role in prevention and early intervention. So what do we need to actually put in place to make sure that happens? And then finally, creating an effective leadership support and delivery arrangement for the VCSE sector at GM footprint. So here, what we're particularly looking for is any of your thoughts and feedback around the role of the Greater Manchester VCSE leadership group. So, you know, particularly, are you aware of the leadership group? Have you been engaged in the work of the leadership group in any way, and has that had an impact on your work and the work of your organisation? So again, really interested to hear your thoughts on that. And then finally, before we move to the discussion, I just wanted to touch on how this accord agreement will actually be delivered once we've got this 5-year agreement in place. So the specific role of the GM VCSE leadership group will be to take responsibility on behalf of the VCSE sector to drive forward that accord agreement and the work to implement it. And in doing so, it will be fully accountable to the wider VCSE sector of the whole of Greater Manchester in making sure that the delivery of that accord agreement actually happens. To do that, there will be a full implementation plan, which is going to look at the detail under those objectives. So those are, you know, they're pretty broad objectives. It's important that there is good detail underneath those to talk about how that's actually going to happen and what the role of different parts of the VCSE sector might be in making those happen. So there'll be the 5-year vision and objective, but those will be underpinned by annual delivery plans with very clear actions, responsibilities, timescales, targets, outcomes, so that we can really clearly measure the impact that this accord agreement is having, both within the VCSE sector, the public sector, and most importantly, amongst Greater Manchester communities. And then finally, how this is being funded. There is a partnership funding agreement between the combined authority, the Health and Social Care Integrated Care System, and the Greater Manchester VCSE Leadership Group. So there is a funding agreement that enables the delivery of this implementation plan. That, of course, will be subject to an annual review and confirmation of budgets from the public sector funders. And then finally, governance and management arrangements. This is an agreement that is absolutely co-owned by each of the signatories. There will be a management group that's set up to review progress towards those shared objectives and targets. And I think a really important part of that is making sure that that isn't kind of closed information, that the whole of the VCSE sector has access to that information, can understand where progress is being made and maybe where some of the challenges are. And there will be evaluation and review on an annual basis. So with now at our questions for discussion, I found it quite helpful to split this into kind of three sort of sections, although the conversations, of course, will overlap. So I think the first section is those first two questions. Are the purpose and scope of the draft accords clear? And can you suggest any improvements? And do you feel that what's written down in terms of that that scope and those principles, does that accurately describe the potential role of the VCSE sector in partnership with the combined authority and the GM integrated care system? And then secondly, I think it's important to look at, will this accord agreement support your work and your ambitions? Is it something that you think you'll find useful? Is it something you think you might be able to use? Will it support your relationships at a locality level? And in doing that, is there anything you'd remove, change, or add? And then finally, what specific actions or activities should be included in the implementation plan? So is there anything that you think is particularly important to be in that implementation plan that is resourced to support the accord agreement? So I realise that's quite a lot of information to go through in a short period of time. I found that the other conversations we've had so far have just kind of flowed across all of these areas. So I think for now, I'll just pause and ask for any initial thoughts or reflections. I will be just taking some notes as we're speaking. So if I'm looking away, that's why it is. Thank you. I will just pause there and open up for any initial reflections and thoughts.
I'll just pause the recording.